My daughter has somewhere between a 98 and 102, but frankly, I never know when to go into the pediatrician anyhow. So let's go ask the expert. So I'm here with Dr. Sakaris at Pediatric Associates, and I'm gonna confess, I still have no clue when to bring my kids in or keep them home. So could you enlighten us moms?
Yes, you're not the only mom with that issue. The biggest problem, fear they have is actually fever. Fever is one of those things that drives parents crazy. And actually fever is the body trying to respond to an illness. Maybe viral, maybe bacterial. But we only really worry about it in children that are less than 3 months, 100.4 or greater, and children that are older than that, 102, and it's persistent. But we also worry if it's associated with earaches, sore throats, vomiting, diarrhea. Those are the things that we're looking for.
Okay, what about rashes? Are there like telltale signs?
Rashes are very important in pediatrics. We really want to see what kind of rash the child's having. Sometimes it may be a viral rash, it may be an allergic reaction. So if we have a rash and it's associated with anything, we would like to see the child.
Okay, and this is a big one, falls. Moms always freak out when the kids fall down.
Falls are a big one, yes, and they a lot of times come when they fall and hit their head. Now, when they hit their head, we worry about loss of consciousness, we worry about vomiting, and we worry about them being more sleepy than usual. Those are the three things that if they're happening, we should take them to the emergency room right away. If they fall and they look okay, we can observe them.
Okay, colds. That's a big one. We never know what to do with colds.
Colds are a big one. Usually older children, if they have a cold, usually it'll last 2, 3, 4 days at most. They should be getting better. That's our guide. If they're getting better, you don't need to come in to see us. If they start with a fever or they start to look worse when they come home from school, then we should check them out.
Of course, if there's a doubt, bring your child in. Hopefully now we have a better grasp on when to stay home and when to come in. I'm Jenny Eisenman, and that's The Scoop.
If you're looking for a pediatrician or would like more information about this segment, visit pediatricassociates.com.